Please join us every week for a new episode of Understanding the Human Condition with Dr. James Flowers. Dr. Flowers and his most admired mentors, respected colleagues, and VIP guests will share valuable insight into underlying health causes, conditions, and issues. These in-depth yet approachable episodes are a great resource for both private individuals and industry professionals. Our esteemed host, Dr. James Flowers, is one of the most recognized and respected names in the field of chronic pain, mental health, and substance use disorders, both nationally and internationally. Dr. Flowers is the founder of J. Flowers Health Institute, located in Houston, Texas. For more information about J. Flowers Health Institute and its concierge services, go to jflowershealth.com or dial 713-783-6655. And be sure to mention this podcast.
Welcome, everyone, to Understanding the Human Condition with your host, Dr. James Flowers.
Hey, Robin.
How are you?
I'm doing great. How are you today?
Awesome.
Good.
We have a special VIP guest. Do you want to tell us who we've got here?
One of my favorite people in the world, David Walsh, who is a psychiatric nurse practitioner, which we'll tell everybody a little bit more about. But David, thank you for joining us today.
Thank you.
Thanks for having me. I'm happy to be here.
Yeah, David's joining us from Austin, Texas, one of my favorite cities in the world, too.
Awesome. So I thought I'd read a brief bio.
Yeah.
Cool with that.
Okay.
David is a board-certified family psychiatric mental health nurse practitioner in the treatment of substance use disorders, a graduate of University of Texas, Hook'em Horns,
There you go.
where he holds an adjunct faculty position at the UT School of Nursing. David is a published author, speaker, educator, and presenter at professional conferences. In addition to founding Dripping Springs Healthcare, David is the COO of CARMAhealth, an addiction healthcare company in Austin, Texas.
Yeah, and I have to say that I personally have used, or professionally, I guess, have used CARMAhealth for, David, a few years now.
Years.
Really, really enjoy what you do, and you bring so much to treatment facilities and so much of your expertise as a psychiatric nurse practitioner to the patients, certainly that I work with, and certainly I'm so fortunate and so happy that you're willing to work with our patients at J. Flowers Health Institute.
I feel the same. It's a joy and a privilege.
Thank you so much. Yeah.
You're very popular with the patients.
Yes.
Very popular.
Thank you.
They always want to do a second session.
Mm-hmm.
Oh, good.
And you have an inspiring story of how you came to work in the substance use disorder and addiction field. Would you be willing to share that with our audience as far as your journey?
I'm happy to share.
Thank you.
How I came to do what it is that I do. Yes. So I am closing in on 50 years old, and when I was 12 years old in 1983, I went to a Police concert with a bunch of guys much older than me, and I tried cocaine for the first time. So I was in 6th grade, and it's sort of that classic story. Like, I did it once, and I just kind of knew for the rest of my life, like, that was it. And I was chasing that.
Yeah.
I was chasing that feeling for many, many years. So fast forward through all the good, bad, and ugly that comes with alcohol and cocaine use disorder. And when I was 38 years old, I'd already been to treatment a couple of different times, and but I really hit what for me was the end of the road. I was very sick and could not live any longer the way that I was. I was very fortunate to have have parents who did not give up on me. And my father came and met me in Austin, and he was driving me back to Atlanta, and we were trying to get to Atlanta so I could go to detox. Well, got about halfway through Louisiana, and I started having delirium tremens and seizures and all that good stuff. My dad pulled over at some gas station in the middle of the Louisiana swamps and bought me a 24-ounce beer, and went back inside and got a straw for me because my hands were shaking so much that I couldn't hold the beer. And I wound up in a hospital in Tuscaloosa, Alabama, going to the emergency department and all that stuff. And I don't remember it very well. People talk about DTs. I did experience delirium tremens, and from what I remember at the outset, it was very frightening. Anyway, I was in this hospital for a few days in Tuscaloosa, and I had a call button, so that I could call nursing primarily for more benzodiazepines, and so I was just hitting it like I was playing Jeopardy, like it was that little, just constantly. And at some point, this guy came in, and I always tell this story that it was a nurse, and honestly, that's my memory of it. But he could have been anyone, tech, respiratory therapist. I have no idea. And honestly, if he was sitting across the table from me today, I wouldn't recognize this person. But what I do remember is that he came in, and he was very kind, and he took the call button away from me, and he sat on the bed across from me, and he said, you can be as happy as you want to be, or you can be as miserable as you want to be, and you have to make that choice. And that was that was my white light moment. That for whatever reason, that person at that time in that place said the right thing to me exactly when I needed to hear it. And I was 38 years old, and I mean, I'm sure I had heard that before in some form or fashion, but had never really internalized it. So I wrapped up my stay at the hospital and got a ride to my parents, and drank one more night. And my dad found me surrounded by a case of empty beer cans in his basement the following day after just having been released from the hospital for like 10 days. And he knew of a place in Atlanta called Talbot Recovery. And so I went there. I spent
wonderful treatment program.
It was fantastic. It was great. 90 of the best days of my life. And then I went in there January 14th of 2010. So I've been sober a little over 10 years, closer to 11 than 10 now. But when I got there, I kept thinking about that guy that I met in the hospital, that nurse, and I kept thinking, if I could do something that impactful for someone else, the way that guy really touched me, but not even by doing very much other than being kind and with some empathy and sort of seeing what I was going through and offering about as much as I could stand at that point. I thought if I could do that for other people, then that would be a life well lived. So I started looking into nursing programs and started taking prerequisites. When I graduated college, I was an art major, and then I played in rock and roll bands, and then I was in construction, for a long time. So this is all foreign to me, this healthcare stuff. So started taking prerequisites, and then looked into nursing programs, and then found out about Psychiatric Nurse Practitioner program, and thought that sounds pretty cool. And one thing after the next. I lived with my parents for about 9 months, and then I moved back to Austin, and then I got an apartment, and then I got a job, and I was riding a bicycle around for a long time. I was making $7 an hour. Then I was working at the psychiatric hospital, but blah blah blah. One thing led to the next, and got accepted to the program at UT. I got my nursing license,
which is not easy to get accepted into, by the way, at UT. Congrats.
Yeah, thank you. Yeah. I was thrilled. Oh boy. I mean, considering where I had been 2 or 3 years earlier.
Absolutely.
Wow.
I was thrilled that anyone even wanted to have a conversation with me, much less.
Exactly.
And so I started that program in 2012, got my nursing license, and in 2015 I graduated with my psychiatric nurse practitioner license, and so that's how I came to the field.
Amazing.
That's awesome.
That is so cool. What was your biggest takeaway, do you think? Was there a defining moment at Talbot that you remember, one defining moment, or was it the overall 90-day experience? And
I will tell you something actually that's kind of relevant to, particularly relevant to some of the folks that we work with at the Flowers Institute. I remember sitting in a group with a guy who was really weeping and just very upset because he had to sell his beach house.
Oh.
And that was his bottom. And I remember I was sitting there and I was thinking, not kind things, you know what I mean?
Sure.
Because I was consumed with my, end of using, which was, homeless, living on an abandoned bus and, no money and all that kind of stuff, and here this guy, he's weeping about, I had to sell my beach house. And so I didn't have much empathy for him at the time. But, I came to realize actually, so I don't know if I had this realization in that moment, but I had it pretty soon after that. I don't know anything about that guy. I don't know anything about the beach house. I don't know what that represented to him. I didn't know his childhood. I don't know if he was first generation, higher educated, first person to make any kind of money, and he built a beach house on a certain spit of land that him and his grandfather used to fish for their dinner. I don't know.
Right.
I don't know any of that. And I don't know the depths of his pain over it. Now, I have never broken a bone.
Mm-hmm.
So my pain, if someone was to, rate your pain 10 out of 10, on a 10 scale, if I get a paper cut, it might be an 8.
Right.
Well, that's my truth, because that's the worst pain that I've ever experienced. And so that guy who was weeping over having to sell a beach house sounds like kind of like a high level problem, right?
Mm-hmm.
But if that's the worst pain that he's ever experienced, that's the worst pain that he's ever experienced. And I cannot judge that. And I can't compare it. Right. And if it brought him to a place where he was making changes to pursue health and happiness, then that's what it was.
Right.
For him, and so I don't know that I realized it in that moment, but that was somehow in there. That was kind of a turning point for me to start recognizing that that everybody has their path, everybody has their pain, everybody has their truth, and it's not for me to judge. I'm just here to help folks along their journey if I can and if they want it. And yeah.
And so what made you decide to become a psychiatric mental health nurse practitioner as opposed to any other career in recovery or addiction? And for those who, that's kind of a two-part question.
Okay.
And then the second part is for those who come from a non-clinical world, describe what you do.
Sure. Okay, so let me describe what I do first.
Yeah.
And then, so I am a psychiatric nurse practitioner. Nurse practitioner is a nurse with an advanced level of training who is able to assess, diagnose, treat, prescribe for conditions. There's family nurse practitioners who are similar to a primary care physician, psychiatric nurse practitioners who do much of the same work as a psychiatrist. And there's some differences state to state in terms of licensure and scope of practice and things like that. But so essentially I'm a nurse with an advanced level of education that allows me to assess, diagnose, treat, prescribe for mental health conditions in adults. And I came into this, primarily because I wanted to be able to give back, because I wanted to be able to help people in the same way that I had been helped. I mean, if I'm going to be truthful about it, I also was in my mid 40s. I had, I don't know if you want to call it lost everything or given away everything or whatever, but, I was in dire straits. It's a good career to be a nurse practitioner financially, and that part can't, I don't think should be ignored.
Right.
But fundamentally, like I said, it was just that brief moment with that guy in the hospital who, that is a moment that I can identify very clearly as sort of being like before and after, like sort of old me and new me.
You know who else says that, don't you, or said that?
Huh.
Do you know who else said a nurse saved her life and there was a moment that is Betty Ford?
Oh, really?
Yep. Betty Ford was obviously a severe alcoholic and tried multiple times to be sober and couldn't be sober. And she was at the, I think it was Bethesda Hospital in detox. And a nurse sat on the floor next to her on the bed, and Betty Ford got on the floor. And Betty Ford said that was her turning moment in life.
Oh, wow.
Yeah. And,
That's
that the nurse was the most honest, truthful person to her at the time, right? Because she was the first lady and this famous woman, and people coddled her, and this nurse didn't coddle her. Told her the truth. Yeah, and she said it was her. That was Betty Ford's turning moment. So anyway, sorry to interrupt.
Oh no, that's interesting. Yeah, and that was true for me. Yeah.
And now you're COO of CARMAhealth. Can you tell our audience about CARMAhealth?
Absolutely. So CARMA is an acronym. It's CARMA with a C, and it stands for Collaborative Addiction Recovery Management and Assistance. When I was still in school at UT, I was very active and vocal in letting people know that I wanted to be working in the addiction psychiatry space. It was one thing, and second was that I intended to start a practice on my own. While I was still in school, I met a guy named Dr. Carlos Tirado. He's an addiction psychiatrist in Austin. Super bright guy, very well known.
Great psychiatrist, yeah.
Great psychiatrist, for sure. Yeah, one of a kind. And so I was introduced to him, and he was good enough to take some time and have a lunch with me while I was still a student. And I kind of told him my story and my background and what I wanted to do, and that I wanted to start a business and this, that, the other. And him with his 20 years of healthcare experience, he was probably thinking, okay, it'll be a little bit more work than what you think it's going to be. But to his credit, he believed in me and what I had to say. And here in Texas, as a nurse practitioner, I have a delegating physician. So it's sort of like a supervisory role that all nurse practitioners engage with the physician in that role. So we talked about that. He agreed to be my delegating physician, and he helped me start up Dripping Springs Healthcare, which is an outpatient psychiatry practice in Dripping Springs, Texas. It was during that time that I actually met Dr. Flowers when I was over there at Dripping Springs Healthcare. And then while I was having that practice, Dr. Tirado for a long time had this vision of bringing addiction healthcare into the primary care space, right? I mean, first and foremost, everyone needs a primary care physician, right? Lots of addiction can be treated in the outpatient space. Lots of psychiatric health concerns, behavioral health concerns can be treated in the outpatient space. And most importantly, a lot of the stuff can be treated by a good primary care provider, right? I mean, there's no reason for people to have to get in line for 3 months and pay a lot of money to get like a little bit of Prozac, right? I mean, a lot of it is takes thought and takes education, but a smart and engaging and thoughtful primary care provider can and should be able to manage psychiatric and addiction concerns in the outpatient space. So Dr. Tirado was really keen on starting this, interdisciplinary clinic that is primarily a primary care practice, but also employs psychiatric nurse practitioners, psychiatric physicians, case managers, therapy like LCSWs, things like that. And so that was sort of his vision. He started that with a couple other like-minded investors in 2017, and then as they launched and things sort of started to happen, They invited me in kind of on the management side of things. A little bit less clinical at that time, but my role is getting to be a little bit more 50-50 now. And so I started with them in January of 2018, came on as the COO. And in the 3 years that I've been there, I think we've probably gone from a census of a few hundred patients to I think we're closing in on 8,000 patients.
Wow. Wow.
We've grown from having one primary care provider at that time to having about 14 practitioners between nurse practitioners and physicians. We've got a staff of over 20. We service a number of facilities across Texas and actually in Florida and even in Tennessee, and we're moving into Virginia. And it's just been a very exciting experience.
Congratulations.
Yeah, thank you. Yeah, trying to normalize addiction healthcare and psychiatric care.
I remember when you guys were starting, and I remember when you were at Dripping Springs, and then you said, "Hey, I'm going into this new role, and it's called CARMAhealth, and let me tell you about it." And I just got chill bumps. I remember going, why didn't I think of that? The entrepreneur in me, right? I was like, damn it. Because it is such a missing piece around the United States, or probably around the world, is because of this, quote, stigma that sometimes family practice physicians have, and primary care doctors and the general population. When you go in and say, hey, this is who I am, and I'm an addict, and what have you, they draw this picture sometimes. And you guys, as a practice, specialize in working with people in recovery. And the amazing thing is that you don't just work at them, they're not there just after treatment or during treatment, but they can be there a lifetime, right? A lifespan. And it's so amazing that they can walk in and it feels like home, right? It's like, I'm welcome here, and I'm an open book, and I can be an open book, and there's no judgment. The idea was brilliant, and it's an amazing practice, and I have begged, I've done everything but get on my knees to ask Karma to come to Houston and beg you guys, something we often talk about. But I think that what you guys do as a practice for this population is just priceless. And so thanks for doing it. I appreciate it. And I wanted to go back to your own life and your addiction and your recovery. And often what we talk about and what the title of this is, understanding the human condition, and what is the human condition. And I'd love to know your idea of the human condition and where you were and where you are now. What was your state of your own human condition and your active addiction versus where it is today, and that span?
Okay. I will. I will try to answer that without sounding either clinical or 12-steppy.
Either way is fine.
Yeah, sure. Well, because I would like to put it in my own terms, and relatable. Being 10 years plus sober now, and looking back on my previous life, that's how it feels, is a previous life. It often doesn't, it doesn't even make sense that was me.
Right.
Right. A lot of it doesn't feel real. And there at the end, I was incredibly selfish. Just incredibly selfish. And what I know now is that I caused a great deal of pain and fear for the people who loved me. I was living in Portland, Oregon. My parents were living in Atlanta, Georgia, and my mom changed the locks on her house I was thinking,
Yeah.
Tough love.
that's a long way away.
Yeah,
And I
it was
had
tough
it had
love.
never crossed my mind to like rip my parents off or anything.
Right,
But that
yeah.
was like sort of the level of insanity that I was kind
Yeah.
of broadcasting, you know? Um, and I was, and then at the very, very end, you know, the very, very end, the last 4 weeks was just an exceptionally frightening time. I remember feeling very alone, very dark. And I can tell you, and I'll tell you one other experience I had in 2009. I was in a treatment center, and I think I was there for 28 days. Apologize for my dogs.
That's all right.
It's all right.
The door.
We
But I
like
was
it.
in
It
this
adds flavor.
I was in this treatment center, and I managed to stay sober for 28 days, and then I had my girlfriend come pick me up, and I was drinking within about 20 minutes of leaving the treatment facility. And then we went back to this little house, and this guy who also discharged from the treatment center came over, and we used drugs. And I remember being in that room, and I know for a fact that there was, call it the devil, call it demonic energy, call it negative, whatever. No one can tell me any different, that there was a third being in that room, and it was just like evil. It just was. And I remember that feeling being so palpable. And I do remember that that when I was getting sober in 2010, I would go back to that experience. And I would think to myself, well, okay, if I know that there was just like a real darkness, evil, fear, cold, empty, void, malevolent force, if I believe that really existed,
Right.
there's got to be the opposite. There's
Right.
got to be the other side of it.
That's right.
And you know, and not to get into like higher power or you know, spirituality or any of that kind of stuff. Like everyone's got their own path to recovery, right? Everyone does their own different thing. And I have no idea what's good, bad, or indifferent for anybody else. I only know what my truth was. But to get back to the human condition part, and I'll relate these two. As I have been in recovery, as I have abstained from substances, as I have lived each day, not necessarily making people's lives better, my own life better, but I do try to live each day and not make anybody's day any worse. Like that's my benchmark, right? If I get through a day and I didn't make anyone else's day any worse, like that's good. That's a good day, right?
Right.
What I have found is that things are lighter for me. Things are brighter for me. Things are easier for me, which is not to say that life is easy and bright and light. But I don't live in fear anymore.
Mm-hmm.
I don't live in lies anymore. You know, boy, I really didn't. Yeah, I don't know. I can just say it like it is. Look, at the end of my using, there was just a lot of very dark, bad, negative shit going on.
There you
right?
go. Yeah.
And since I've gotten sober, it doesn't mean that things are perfect. Doesn't mean anything. It just means that I am so much better equipped to manage my life and the world around me and as it comes to me. And it's just like you hear people say, I mean, if you just keep doing the next right thing, I mean, the stuff just builds on itself and it stacks and gets better and flourishes. And I will say this, if someone had told me that, you know, when I was getting sober, that, you know, at 3 years you will have rebuilt X amount, and at 6 years you'll have rebuilt X amount, and at 10 years you'll have rebuilt X amount,
Yeah.
on the one hand, I would have said, well, Jesus, 10 years, man, to get there. Like, I don't know if I could.
I don't know about that.
Put in that time.
Yeah.
But then there's also that sort of thing, like, dream your wildest dreams, and you will see that what you get, like, is going to make that stuff sort of pale in comparison.
Absolutely.
And I found that there's a lot of truth in that too, just like the mystery and the joy and the color and all the cool stuff. Not to be like a proselytizer for like, oh, get sober and everything's gonna be cool, but I got sober and everything's cool.
Yeah.
That's a really good inspirational story.
Yeah.
A great success story.
It is
for those who are listening, it really is. That's great.
It is. Yeah.
So fortunate. So fortunate.
You work with a lot of, or virtually work with all of our patients at J. Flowers Health Institute. And being a mental health professional, being a psychiatric nurse practitioner, and then working in recovery, being in recovery, what's one piece of advice you'd give the audience that has a family member that's struggling with depression or bipolar or even borderline and addiction together, kind of that comorbid mental health addiction combination? And there's lots of parents out there and moms and dads and brothers and sisters that have someone in their family that they just don't know what to do, how to help them. What advice do you have wrapping up here today?
Oh, boy. It's kind of, there's a strange balance that I've got to encourage the families of the ill patient to strike, which is, don't give up on your loved one,
Right.
And provide all the support you can, but hold your boundaries, right? I did not understand what, how much of a family disease addiction was until, I went through it. I remember going to one treatment facility and, after like a day, I was like, oh, I need the phone. I got to call my parents. They're like, no, actually your parents need a break from you, dude. You do not need to call them. They don't want to be here.
Oh my gosh.
But there's so much about addiction that impacts the entire family system.
Yeah.
And, and the non-using part of the family, out of a place of love often winds up in sort of this enabling profile, right? And winds up being hurt and sort of, going through their own kind of stuff. So, the advice that I would offer to families is, love your loved one, support your loved one. But, oh my gosh, first and foremost, love and support yourself, because, I'm not telling anyone anything they don't know. You can't change someone else.
That's right.
All you can do is change yourself and look out for yourself. And it's the hardest thing in the world to do, to love someone from a distance and to tell someone that, you have done what you can do and that this is the kind of support you're willing to offer, but ultimately that's it. You got to take care of yourself first, and your loved one is going to choose to get better or not get better. And that's just a very, very difficult, almost kind of like a TV show that you got to watch,
Absolutely. Sometimes soap opera. Well, I have no doubt. I have no doubt that eventually your family's door was reopened to you, and I'm not sure if your mother ever gave you a key to her front door again, but I know that door is probably open for you.
They've got to be really proud.
Things are better than I could have ever imagined.
Yeah, that's so cool. How do people reach CARMAhealth and look at your website, and how do they reach you guys?
Yeah, awesome. Thanks for asking.
Yes.
CARMAhealth.com. Karma with a C, and CARMAPsychiatry.com, also Karma with a C. You can Google us in all your Google pages. We are in Austin, in Dripping Springs, and actually in Florida. And if someone really wanted to find us, I'm sure they could go through the Flowers Institute and get our contact.
Yeah, absolutely. I can't thank you enough for doing this and spending time. I know how busy you are, and really running CARMAhealth and your own practice and everything that you do in your life. And huge congratulations on your sobriety and the life that you live today, because I try to strive to be as good of a person as you are, David, all the time. And so thanks for being a part of what we do, and thanks for being a part of what we do today. Robin, how do people reach us?
jflowershealth.com, or they can call us at 713-783-6655. And please mention that you heard our podcast.
Absolutely. Yeah. David, thank you so
Thank you.
much. Yeah.
Well, thank you. And if I can just add one thing, Dr. Flowers, I want to thank you for having me. And it should be acknowledged that when I started working with you, I was a relatively green practitioner. And you have played a significant role in my professional development. I hold you very dear to my heart.
Thank you. Yeah.
So
thank you.
Yeah.
Now I'm going to cry.
I know.
Thanks, David.
All right.
Love you,
See you
man.
soon.
Yeah.
All right.
See you
Bye.
soon. Bye-bye.
Thank
All right. Okay. Thanks, y'all.
Yeah.